It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on our show today, we're going to hear from interventional cardiologist Dr. Annie Varughese and how she was able to help Bill with his heart palpitations.
I was pretty healthy up until I hit my 30s, and when I hit my 30s is whenever I was diagnosed with diabetes, and then from that point on, they start treating you right then for cholesterol. They start treating you for high blood pressure. I had started taking tests, and they changed my blood pressure medicines up. I woke up one morning and my heart was just out of control.
He presented initially with palpitations. Palpitations because of medication that he was taking for high blood pressure. He was not tolerating a medicine. And this medicine is a great medicine for blood pressure, but for him, it caused palpitations. So here's a classic example of how medications are studied, tried and true, used for years, but each patient is their own entity. Each patient processes medications in a different way. And for him, this medication was stimulating his heart, not quieting it down.
I would feel pretty confident that if it had kept going the way it was going, I would end up having a heart attack. A lot of blood work was done, and once we pinpointed the problem, we put me on the right medication. I've been fine ever since.
And I had to, of course, immediately take that away, give him other medications that proved to be beneficial for his heart rate and his blood pressure. And he has done very well over several years, been very faithful to our practice, and brought many of his family members because of what we were able to do for him.
As far as how I feel now versus how I felt from the beginning, I feel 100% better, and not having to worry about waking up in the morning and your heart just be racing out of control. It's a good feeling not to have to worry about that taking place again.
Bill is doing fabulous. He is able to run his business. He brings his family members to be checked because he knows that there are rules and you follow the rules. And when you follow the rules, you do well.
The outcome of it is pretty good. I mean, like I said, if you can control it, and I stay on, and I take the magnesium pills, and it keeps everything under control. I haven't had any issues since. I expect to live for a long time, I hope.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fights infections.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face, and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility. This is the best doctor. And I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
To request an appointment with any of the amazing physicians you've seen on the show today, head to our website. It's bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's podiatrist, Dr. Gabriel Maislos.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using a microtip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. Stretching can help boost circulation and digestion, and even ease back pain. Remember when stretching to hold each position for about 25 seconds and to breathe deeply.
For more information and to check out hundreds of videos on all the amazing doctors that you've seen on our show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to hear from ear, nose, and throat specialist Dr. C.T. Nguyen and how he was able to help Aaron with his inability to breathe and nasal congestion.
My symptoms were like I would always wake up in the middle of the night having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
Lethargy, just tired all the time, anxious, couldn't let my mind relax. Paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle. About a week or two before it happened, she would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with Progester, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart. That is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh, yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today, and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
Quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our objective, original objective of research and education. But at the same time, we've made many advances in just clinical medicine, surgery, and have enjoyed a leadership position in this new development now. It's sort of inspired the entire medical community around the world. And you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
For more information and to watch hundreds of videos on the doctors you've seen on the show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to see how Georgianne, who was embarrassed by her smile, was able to start smiling again after a smile makeover from cosmetic dentist Dr. Guy Lewis.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I had tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. You know, and once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but People who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's and my mother was across the room from me. My mother's 82 years old. And she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone. And after I feel like I can take on the world, I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me, and then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
Patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Those were some amazing doctors on today's show, but that's going to wrap up this edition of Best Docs Network, featuring some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.